Read something interesting today I wanted to share with you. It was from a therapist who was working with a couple, and the couple came to the therapist stating that they felt after several years of marriage they were feeling like they were being pulled in two different directions, the growing apart, and they wanted to come back together as a couple a little stronger with more connection. Well, this well meaning therapist decided that the most important thing was his or her theory. And so they jumped in trying to do really emotional focused work with the couple, doing all this kind of structural redesign in the relationship, all these kind of things that unfortunately for this particular couple seem to work against their goals. And all three, the therapist and the couple, all three of them decided that things weren't going too well. And if anything, they felt things were worse since they started therapy. Now, this really was perplexing to the therapist, so they staffed this at a supervision consultation group. There was apparently an older and wiser therapist who asked, well, what's happening? And the therapist said, well, I'm doing this, I'm trying to get the husband to feel his emotions more, to sit with him. I'm trying to get the wife to work on more assertive interactions when he's upset, and that, all this kind of, going into each person's childhood to kind of, figure out what the blocks are. And the older and wiser therapist just said, listen, if they want to be closer, ask them about times when they were closer, meaningful times when they were closer, and have them every morning for 5 minutes, just the two of them, sit, look into each other's eyes, hold hands, and talk for 5 minutes about those times and how much those times mean to them. Then in 2 weeks, find out where they are. If they feel like they're getting a little closer, continue it. If not, we'll do something different. Well, sure enough, somehow the couple, after doing just this very easy activity, found that they felt a little more connected, felt a little more comfortable with each other, felt a little closer. So the moral of the story is sometimes just because something is complex doesn't mean it's the right answer. And in many times I find in therapy, complexity does not always end with effective results. Years ago, I remember there was a study I read where when someone gave a answer to a question to an audience and made a very complex assertion, sometimes the audience was more inclined to think that the answer was genuine or true more than if the speaker gave a really direct, simple, and usually true answer. So maybe it's something in our brain that we think that the more complex things are, that they're more right, they're more correct. But a lot of times just stating to ourselves what's the goal, what's the simplest way to get from point A to point B, is nothing wrong with that. Sometimes it's the best thing we can do. So if you find that you're getting too bogged down and trying to work with your clients and find out you're going in all these different directions, maybe stop and say, am I making this too complex? And does it have to be complex? Or could it be really a fairly simple thing of adjusting interactions, adjusting patterns, challenging, minor things here and there to set people back on the path that they want to get to, which is their preferred outcome. Anyway, just thought I'd throw this out today. Hope you're having a great day. Feel free to subscribe if you're interested in some of these ideas that I'm sharing, and I look forward to seeing you on the next video.